CataractCoach.com, podcast series episode number 83 with Dr. Luis Escaf, father and son podcast in English and in Spanish. Welcome back to our Cataract Coach podcast. And today I have two very special guests, something we've never done before, a father and a son, both amazing ophthalmologists. You probably know the more senior Dr. Luis Escaf, who's a famous ophthalmologist from Barranquilla, Colombia. He started a huge clinic there. We're going to learn all about it. And today we're going to do something a little different. We're going to do the podcast, la mitad en English, la mitad en español. So half English, half Spanish. We're going to have a good time. Do not worry. So, hola, amigo. Estoy listo por un gran podcast contigo y su hijo.
Gracias, Uday. Un placer estar contigo, disfrutando este podcast con un gran amigo como eres tú. Y
Oh, thank you.
esa fanaticada que tienes en tu Cataract Coach.
Yeah, so you've submitted multiple videos for Cataract Coach. And the one I like the most is the idea behind the Ultra Chopper.
Así es.
Tell me a little bit about the Ultra Chopper.
Echarle la historia del Ultra Chopper.
Ok, hace muchos años ya, hace más de 16 años, viendo cómo partían un pavo en la televisión con un cuchillo eléctrico,
Uh-huh.
ocurrió que podía crear un bisturí ultrasónico.
Wow.
Entonces, tomamos una punta de faco y la adelgazamos, la torneamos bien y así, y en una catarata que había hecho una extracapsular, corté por primera vez la catarata, una catarata negra. Y bueno, ese fue el inicio del bisturí ultrasónico, como se conoce hoy, el Ultra Chopper. Después vino una serie de pruebas con ojos artificiales y hacer planos, y 2 años trabajé con ellos hasta que un amigo mío, el doctor Juan Valle de República Dominicana, estuvo conmigo aquí en cirugía y me dijo: Luis, ¿por qué no lo patentas? Y hombre, yo realmente estoy trabajando con él, pero vamos a patentarlo. Y hicimos unos planos, hicimos un prototipo, se lo mostramos a mucha gente y Alcon se interesó por él y vino Mijail Bournier, tú lo debes conocer, Mijail Bournier, que trabaja con Alcon, vino a mi clínica y Alcon mandó una comisión a ver si era verdad que eso servía o no. Y
Wow.
aprobaron y lo desarrollamos y Alcon compró la patente.
So basically, like 16 years ago, he had an idea. He saw something and said, why can't we attach something to the tip of the phaco probe, the bisturi, the instrument, or the knife? And he wanted to be able to cut into a very dense or brunescent, dark black cataract, which, of course, in your clinic, you see very often. And so the idea was born. The device basically attaches to your phaco tip. You take off the phaco needle, you put the tip on there, and using the ultrasound power, you can dive that right into even the densest nucleus and allow you to split that nucleus into quadrants. And now there are more versions of it too. Luis Jr., do you have anything to kind of maybe explain a little bit too? Or translate even?
I remember that this was 16 years ago, more or less. So I was not even a physician, but I remember going with him to a guy that was like 20 blocks away from here that was did the 3D models of the tip. So I remember it was like that was my introduction to ophthalmology, designing this strange tip that was used for hard cataracts. And I remember that the issue there then was that we had to keep a few openings for the fluidics to still cool the tip, or
Right.
to burn the corneal wound. So I remember that 16 years ago. Yeah.
So it's kind of neat. So maybe that had some influence on you to help you choose ophthalmology. Because, you know, my kids are in medicine too, but I'm not sure they're going to do ophthalmology. Tell us a little bit about your background.
Yeah. So maybe I remember when I was 14, 15, that my introduction was, I used to like a lot computers and video editing and all and this. And in that time he was doing a high volume of cataract surgery, and he was starting to be very important in meetings, so we had to share his videos. But I remember that time that we used VHS, and he had a bunch of bags downstairs full with videos. And my sole job at 14, 15 years old was trying to work how to digitalize those VHS videos
Wow.
and help him edit the videos. So I remember that I know by heart all the steps of cataract surgery. I have seen thousands and thousands before I was 17, 18. So,
That's amazing. That's amazing. Because, yeah, back in the day, when I first started, everything was on VHS tape, which for the
Right.
young ophthalmologists who don't know, these are like plastic boxes that have a magnetic tape inside, and it's not digital at all. And so you digitize that, help them edit it.
Yeah.
It's just totally amazing. And so then you decided to go to med school too, then?
exactly. But I already knew I was going to do ophthalmology. That was like, I knew I had to go through those 6, 7 years and then just go into ophthalmology. And yeah, then I got into, when I went to ophthalmology, actually before going to ophthalmology, I did like a round trip around the States, and I
Okay.
was with you a month or two. I was a month or two with Federico Vélez, your friend, and I
Here in
remember
Los Angeles, yeah.
going to Olive View and seeing you there with your residents, and then I went to ophthalmology.
Wow, so that's fantastic. Now, you did your ophthalmology training there in Colombia, but then you also did a retina fellowship in Toronto. So
Exactly.
what attracted you to retina? You got too much cataracts?
I think I already knew everything around cataracts by then. So I wanted like a new challenge, and retina seemed to be challenging to me, and the field in my era of ophthalmology, 2019, 2017, retina was the booming thing, and there were a bunch of new things. So I went to that. But yeah, I still do cataract surgery, and I enjoy it.
Well, I think retina surgeons who also do cataracts are the most amazing surgeons, because now you can do the very complicated trauma. You can do the full pars plana vitrectomy. You can do the sutured in lenses. You can do the most complex things that I can't do. I don't do pars plana vitrectomy.
Of course. Yeah. And actually nowadays we book cases together. Like if we need, I don't know, subclux cataract, we sometimes do it together, and that's a really cool, nice way to enjoy our time, father and son, in the OR.
Oh, that's fantastic. Let me do a little español for your dad. So, el doctor Escaf es el jefe de la clínica oftalmología del Caribe en Barranquilla, Colombia. Y su hijo Luis es cirujano de la retina en la misma práctica.
Así es, así
Yes.
es.
So
Él saca los núcleos que se me van a mí.
his dad says he takes out the nucleuses that I drop in the vitreous. So
Son muy pocos.
yeah, very, very little, but well, I always say 100% of surgeons, 100% de los cirujanos tienen complicaciones. Es la
Total.
verdad. That's the truth. 100% of surgeons have complications. So, por favor, dígame cómo su clínica llegó a tener tanto éxito.
Bueno, son 38 años de ejercicio profesional.
38 years. So I asked, how did your clinic become so amazing? And he says he got 38. So for 38 years.
Sí. Comenzamos con un consultorio.
Started with just one room.
Un consultorio de 40 metros.
Wow, that's it.
Ahora tenemos cero quirófano, cero. Después adecué una casa, hice un quirófano.
Wow.
Ahí trabajé 10 años. Después hice mi primera clínica grande de 2,000 metros cuadrados con 4 quirófanos.
Wow. So he did first was just one tiny little clinic of, what was it, 40 square meters, so maybe 400 square feet, which is nothing, which is just one consultation room. And then he grew, and then 10 years later, you said it was what, 2,000 square meters, 200?
2,000. Well, now it's like 6,000 square meters.
Wow. So 6,000 square meters, and for my American friends, is 60,000 square feet.
Exactly.
¿Y cuántos cirujanos en la clínica? Muchas.
72.
Wow. Starting from one doctor in one room to a huge clinic with 72 doctors. Wow.
Yeah, and 850 employees. So that's a lot of people, big family.
20 quirófanos.
And we have 20 wars.
20 hours.
Yeah, all
Wow.
clinics. Yeah. Yeah.
Even in Beverly Hills, we only have 7.
Wow.
Le quedó 4.500 frente diario.
And we have more or less the number that we see to all the physicians, more or less 4,500 patients every day.
A day.
A
Yes.
day among all those.
Diario. 4,000 pacientes diario.
Yeah.
Wow. That's amazing.
Sí.
And I remember that we used, not anymore, but before we had a family thing that was when we went for vacations. If we went, I don't know, to LA or New York or Brazil, the one part of the vacation was visiting clinics. So we know a lot of clinics actually.
Well, that's very important. When you visit other people, you can learn so much. How they run things, how the operating room works, how they operate. So that's very so you had a lot of ophthalmology exposure from a very young age.
Le estoy contando que íbamos de vacaciones y
Sí.
visitábamos muchas clínicas.
Cuando fui de luna de miel con mi mujer,
Honeymoon.
me fui a ver una clínica.
Oh God. He said even on his honeymoon, when he went with his wife, he went to go check out other people's clinics.
Yeah.
That is the true passion of ophthalmology.
No
Yeah.
solamente somos una clínica ahora, porque hacemos educación, tenemos residentes y fellows.
So it's not just clinic. It's about education now. He has residents, he has fellows. Wow. So in all subspecialties, cataract, retina, everything?
Yes, cataracts,
Glaucoma.
retina, plastics, glaucoma, and a full program of residency program.
Wow, that's amazing. Resident, and then also fellowship as well.
And fellowship as well. Yes.
Am I too old to be your fellow? Can I come?
You're fully trained by now.
Oh no! Always things to learn.
Sí. Hemos formado unos 200 oftalmólogos de toda América Latina, de todos los países de América Latina.
So in all the Americas, he's trained like 200 ophthalmologists. Wow. That's amazing.
Un departamento de investigación donde probamos tecnologías nuevas que todavía no han salido, que algunas compañías vienen a probar aquí sus dispositivos.
So clinical investigations, clinical trial department. So you're involved too, Luis Jr., right?
Yeah, I actually am involved in the clinical trial department. That's my part-time job.
Tell me about that.
Sorry?
Tell me about the clinical trials and how you're involved, what your involvement is.
So in Colombia, here you have to get a certification with the government to do clinical trials.
Okay.
So I had a gap year between medical school and ophthalmology.
Okay.
So in that time, my job was setting up this clinical trial certification for the clinic, and also I worked for a startup that you guys may know that is called Transcend Medical.
Wow!
So that was my part-time job, doing clinical trials certification and working for Transcend in California. So that was my gap year, and then I went to ophthalmology residency. Estoy contando de Transcend. Yes.
Well, so you have ophthalmology in your blood.
Yeah.
This is amazing. So that's fantastic because the clinical trials are so important for the development of the future of ophthalmology.
Exactly. Yeah, and actually, I think it's super important, or it's a very nice experience to be on the other side and see ophthalmology from the lens of industry. Because sometimes as physicians we only see our part of the story, but industry plays a key role in new technology. You are involved with startups, I guess, in new technology that is going to change our field.
Right.
And the other thing that we have been involved is we have done some AI algorithms in glaucoma and in retina that we use nowadays in the clinic to read out the printouts of visual fields or OCTs of maculas and optic nerves. So yeah, that's more or less the overview of the clinic.
Wow, that's amazing. So tell me more about the artificial intelligence, because I have a big interest in that too. So you're using it on the diagnostic side.
Exactly. So like 5 years ago or 6 years ago, we had a issue here in the clinic that visual fields from Humphrey visual fields had to be read by the glaucoma doctor, and he had to send that report to other physicians and also to insurance companies for billing purposes. So we decided to create this project to train an artificial intelligence algorithm to read these Humphrey visual field printouts. And the name of the algorithm that is being used now is called Patri, which is a small name for Patricia, which is the first glaucoma physician that worked for the clinic, and she was involved in the project as well. Yeah, so that's more or less
How accurate is it, and is it continually learning or self-learning, self-improving?
It is pretty accurate. We have done small trials with it, and it's 92% close to what a glaucoma trained physician would read at the print. And we're working in order for it to read out or interpret a progression, because it's only readouts standalone tests. Yeah.
Wow, that sounds fantastic. So, question for your dad: how did you grow the practice so much? Because you can't conceive we went from a one solo doctor, un doctor solo, en un cuarto, y después de 38 años, you have 850 employees. How?
Bueno, es una inquietud manifiesta y siempre quiero hacer más cosas y siempre quiero aprender más y siempre quiero ser mejor en lo que hago. Sobre todo que en estos países todo está por hacer.
Wow.
Es diferente a vivir en un país del primer mundo que todo está hecho, que en un país donde hay muchos problemas y cada problema es una oportunidad para crecer.
Wow. Luis Jr., you want to translate a little bit just for the audience?
Yeah. So he always wanted to be the best surgeon he could, and also create the best clinic that available in this part of the country. That was what you said, but I would add that he said that maybe in developed countries you start practicing and you have everything available for you, and
Right.
you can go to a big hospital or big practice and you have everything. But in our countries, ophthalmologists have to lead the way in creating these top-notch institutions because they were not available 30 or 40 years ago. So
Yes, it's even more challenging. It's
Like-
probably easier to do somewhere like USA, where we have a lot more resources. For you, it's even more challenging. It's even more amazing.
exactly. And I remember a story that when you came here, he trained in another city in Bogota, in the capital, and he was trained to do already extracapsular cataract surgery with IOL implantation. And I remember that he said that he had to build his own OR because he had to go to a big hospital that didn't have a microscope. So
Wow.
le estoy contando que le hiciste también por necesidad.
Sí, total.
That it was a need for him to create the clinic that he wanted to practice to the highest level. Yeah.
And then just slowly, cada año más grande. Every year, just a little bit bigger.
Exactly.
Sí. Todavía hay mucho terreno para crecer en todo el país. Todavía hay muchas necesidades. La tasa de cirugía de catarata todavía es muy baja por millón de habitantes. Y también la parte de córnea, hicimos un banco de ojos, tenemos un banco de ojos que antes no lo había en la ciudad, ¿no?
Wow. So now you have an eye bank now. Everything.
Yeah, so that's a little bit the same story. So 10 or 15 years went by and we had this big clinic that was doing a great job. But for example, in cornea, we didn't have corneal tissue. So, or we did, but we had to wait 1 or 2 or 3 years for one corneal tissue to arrive. So we said, okay, so the government doesn't seem to be interested in building an eye bank, so we'll have to do it. So the main corneal eye bank for this region is the clinics.
Yeah, that's wild. Because in the US, if I wanted to do all this, we already have the eye banks. So for you don't have an eye bank, so you just have to build the eye bank also. It's even more work.
Yeah.
Yes.
Yeah. Yeah. Yeah.
Wow, that just is it's just even more amazing. Now, you said that earlier it was extra cap surgeries, but then it changed. So, ¿cómo ha cambiado la cirugía de cataratas a lo largo de su carrera? Like, how has cataract surgery changed in your career?
Yo comencé haciendo intracapsular.
You started with intracaps,
Yes.
with the cryo probe, el cryo.
Con el
Creo.
extracción.
Cryo extraction, cryo extraction, y alpha chymotrypsin, the
Después
enzyme.
Yeah.
extracapsular autodidacta.
So you learn by yourself extracapsular surgery. Yeah.
Y aprendí FACO con los videos de Osher.
He learned phaco from videos from Osher. I love Osher too. He taught me when I was a resident also.
$200 por cada cassette.
Yeah, back in the days, it was $200 for every VHS cassette of Osher's video journal.
Y ahora CataractCoach es gratis.
And right now, CataractCoach is gratis and worldwide, and it's on your phone.
Yes.
Yes.
Es increíble.
It's amazing.
Ahora
amazing.
el que no aprende es porque no quiere, ¿no?
See, if you don't learn phaco today, it's because you don't want to. And
Right, of course. Yeah, there's almost no excuse, because today we have anywhere on the planet, you get your mobile phone in high definition, you can learn a surgical procedure. Like I had to learn myself how to do DSEC and DMEC, and I learned by watching videos.
Yes.
Okay. Sí. Wow.
Cada 2 años hacemos el Congreso de Segmento Anterior más grande de Colombia, FACO Caribe.
So every 2 years, he has a big phaco conference called Phaco Caribe.
Que tú nos vas a acompañar el 2026, ¿no?
In 2026, I'm coming. We're bringing all the CataractCoach fans. We're going to have a great time. I will love it.
Yes.
Yes.
Tell me more about the conference Phaco Caribe.
¿Cómo empezó Phaco Caribe?
Bueno, teníamos la necesidad de traer gente para que nos enseñara.
You got to have a lot of people coming so we can teach them.
Yes. Y fue creciendo poco a poco. Lo hicimos hace 16 años.
Okay. So 16 years.
El primer congreso asistieron 100 personas.
Okay, first Congress, 100 people.
Este año vinieron 1,600 personas.
Wow, this year 1,600 people. Wow.
Unos 120 conferencistas de todos los países, de 16 países. De todo el
Wow,
mundo.
from all these different countries. That's amazing.
Entonces, es la forma de traer aquí a nuestra ciudad, a nuestra clínica, los mejores oftalmólogos del mundo para que nos enseñen a nosotros, a los residentes, a los fellows y a nuestros oftalmólogos locales.
Right. He's made his clinic basically the best for teaching residents, fellows, and even surgeons like me in practice who want to come for the conference and learn there. Now, tell me more about the conference. How many days? ¿Cuántos días es la conferencia?
4 días.
4 days.
Hacemos un día de subespecialidades.
One day of subspecialty. Yeah.
Retina, plástica, optometría, instrumentación. Y después hacemos en un salón muy grande donde caben 800, 1,000 personas, temas de catarata que combinen con las otras subespecialidades.
Wow. Luis, you want to add something to this? Tell me more about the conference.
And I think now that it's much bigger, it has served as a very nice platform for, that we have 72 ophthalmologists, and aside from working and day-to-day work, we like Paco Caribe to be a platform to them to get to know other physicians or their colleagues around the world, to share with the academic part of their fields. So oculoplastics has grown a lot. The retina has grown a lot in the recent editions. Glaucoma has been a huge thing because it's fairly, it touches bases with anterior segment surgery, and so it has been a great platform for all the other ophthalmologists from the clinic.
Yeah, I think that's important to keep in mind, that you can't just do cataract only. So catarata and refractiva have now combined, but now also también con glaucoma, also with glaucoma now, because you do phaco, you want to do a toric lens for refractive outcome, and you also put in some sort of MIGS device. You're also treating the glaucoma.
Exactly.
And then also even getting into more, y también la retina. So now you got the patient with a macular degeneration where you may have to change the way you do the surgery, or maybe you're also given an anti-VEGF prior to the surgery. So you have to be knowledgeable in everything now. It all come together.
Exactly. Yeah. Even we do sometimes combined case for floaters. I don't know if you have those.
Oh, algo frotando en la vista. This is Beverly. Mi clinic is Beverly Hills. Believe me, they complain a lot. They always come. So I have to tell them when I said, when I do your cataract surgery, your vision will be brighter, sharper, and clear. But your floaters will also be brighter, sharper, and clear. Entonces, con su cirugía de catarata, la vista va mucho más clarito. Pero también, algo flotando en la vista, más clarito too. So the same thing. It's going to be even. But no, I have patients there. Yeah, you often do vitrectomy for floaters. Floaterectomy, we say in the U.S.
Do your patients see these videos and comment about what you say or not on these conversations?
I don't know. So if they do, I don't mind, because if you're a sweet patient, I love you more. If you drive me crazy, then maybe I won't even do your surgery.
Okay.
Right? There's a rule. When you do the surgery for the patient, you own the patient, and the patient owns you. Translate that for your pops, for your dad. Tell them.
Regla, que tiene una regla que cuando tú le haces una cirugía a un paciente, tú eres dueño del paciente, pero el paciente también es dueño de ti. Sí.
Total.
Right. ¿Qué es lo más importante para que un joven oftalmólogo tenga éxito en el futuro? So what's important for a young ophthalmologist to be like successful in the future?
Bueno, primero tiene que tener pasión por lo que hace.
First, have to have passion for what you do.
Pasión por lo que hace. Entrenarse bien. Saber que esto, en lo que aprende hoy, ya mañana se desactualiza. Tiene que seguir aprendiendo permanentemente. Si no,
You got to keep learning, for sure.
se va quedando. Yo opino también que debe buscar un grupo de colegas, porque es muy importante el trabajo en grupo para poder actualizarse más fácilmente, ¿no? Yo siempre les aconsejo a la gente que se forma conmigo que haga siempre su grupo. Se quedan solos en un consultorio, no pueden salir, no pueden actualizarse. Es muy costoso comprar equipos cuando es uno solo. Y bueno, lo más importante es enamorarse de la profesión, enamorarse de los pacientes, tratar muy bien a los pacientes. El éxito está en la forma de manejar los pacientes. Los pacientes no saben medicina, no saben oftalmología, pero sí saben cómo tú los tratas, con cariño, con respeto, siendo amables con ellos.
So patients don't know ophthalmology, they don't know medicine, but they know how you treat them. So if you treat them, you give them the best, they know, they feel that, they understand that. And then also, you don't want to work kind of solo in one room by yourself, and not, you need to be working with other ophthalmologists, other colleagues, with kind of like a team. You'll learn better that way. No, that's all great advice. Now, you're a very young ophthalmologist, Luis Jr. You have no gray hair at all. So yes. Tell me, what did you, at your stage, what's been important to get to your point, and what do you think will be important in your future? You had a long journey too. From 14 years old editing videos, then you had to go to medical school, then you had your gap year, then you did this project, then you did ophthalmology residency, then you went to Toronto, did retina fellowship. Now you're coming back as a young faculty. And in 5 years, with all this work, you're going to get gray hair.
Yeah. I'm starting to get a little bit. The camera doesn't show it, but well, what I think is important. I always remember something that his mentor said to him, and he said to me, was that always have some sense of insatisfaction. That if you feel too satisfied about what you are doing, maybe you have to see something, visit someone else, go to another clinic, go to a meeting, because there is something that like you can improve. So for me, I always try to look a little. I always when I was training, I wanted to live different experiences. That's why I went, I don't know, to UCLA and see Federico, see Strabismus, which I didn't really like, but I think it was cool to see this practice. And then I worked for this startup just to see how technology is developing ophthalmology for a few months only. It wasn't a lot. Then after residency, I wanted to go to another country just to see how things were done, push myself a little bit. So I went to Canada in the University of Toronto, and now I try to do the best job I can in retina and in cataract surgery, but I try to get involved in academics, clinical trials, because you have to pick a little bit of everything. And maybe in 20, 30 years, I'll just do private practice as you.
Ay. Teníamos que hacer una clínica con toda la tecnología que hay en el mundo para que no se me quedara trabajando en Canadá.
You would translate that? It's funny.
So yeah, that he wanted to do the best clinic that he could because that was the only way for preventing me to going to the US or Canada and staying there and not coming back and working to the business.
I just think it's because a young man like you who's grown up in Colombia, especially in Barranquilla, you've never seen snow in your life, and you wanted to go to Toronto in January and February where it's minus 20 degrees Celsius.
Yeah, it's crazy. I look pretty out of place there.
But somehow you survived. We got you a good winter jacket.
Yeah, I got it. Nunca había visto la nieve, me fui a Toronto en menos 30 grados. Sí.
Aquí estamos a más 30.
Right. Yeah, it's like 30 degrees Celsius, or like 90 plus degrees there when you're in Barranquilla. It's much warmer. It's the Caribbean.
It's the Caribbean.
So I like your advice there, though, of always being a little kind of unsatisfied or just yearning or desiring to learn more, to keep learning more about different things. Learn more, obviously, for you in retina, but also how the clinical trials work, how to develop a new product, how to do so many new things. That learning is the key. I think the key for all of us is what your dad said. You have to keep learning your whole career.
It is because it's impossible to be fully trained and know everything after 4 years or 2 years of fellowship and residency. Like, it's impossible. There are gonna be things that you don't do or you don't know much about, and you have to keep looking. I guess you have to keep educating. Now I guess it's easier than for you guys. que ahora es más fácil educarse y aprender nuevas cosas.
Además, la mejor forma de aprender es enseñar.
Yeah. The best way of learning is to teach.
Claro. Eso es lo que nos mantiene actualizados a nosotros, que todos los días estamos en contacto con residentes, con fellows, con otros oftalmólogos que vienen aquí a visitarnos y aprendemos de ellos todos los días.
So every day he's with young residents, fellows, visiting doctors, and by teaching, you're actually learning. In fact, that's a great way of putting it, because to teach someone, you have to really understand the topic.
Y es muy emocionante, ¿no? Porque todos los días es diferente. Todos los días nos estamos moviendo, haciendo cosas diferentes, en charlas, en webinar, visitantes, profesores, amigos de todo el mundo que nos visitan y estamos conectados por grupos de WhatsApp donde comentamos y todo. Entonces, es fácil enamorarse de la oftalmología cuando estamos rodeados de tantos amigos.
Well, you want to translate for us?
Yeah, that ophthalmology is more exciting when aside from working, you make friends by teaching, going to meetings, maybe going to places that you weren't planning to go, and having friends in ophthalmology. That's so for him, it's easy to get in love with ophthalmology if you live it in that way.
I think that's you're 100% right. 100%, absolutely. Because it's your passion, as you were saying before. So that's fantastic. So I also think when you told me that on your honeymoon you went to visit ophthalmology clinics, that tells me you will never retire. You cannot.
Si te vas a retirar.
Nunca. No, no way.
No, no hay forma. No hay.
Yeah, I think if you retire, you die, probably.
Well, this is such a pleasure for you, such a passion. I think the smart thing is what you're doing is give more responsibility to other doctors, and you can enjoy the things you like teaching and meeting other doctors from around the world.
Exacto, yeah. Que ahora estás disfrutando más porque has dado más responsabilidad y has podido disfrutar más de la oftalmología.
Y ya solamente hago dos cosas, catarata y refractiva, más nada.
Yeah.
Antes hacía de todo, dacrocisto, rinostomía, retina, glaucoma, blefaroplastia, pterigio, todo.
Yeah, and in your clinic, you have some amazing doctors. I was at the Colombian Congress with you, and maybe a month or two ago, and you had so many doctors from your clinic who had such incredible videos.
Actores talentosos.
Sí. La mayoría son entrenados por nosotros.
So they're all trained there. That's a family. That's su familia. La clínica es su familia.
Total.
Yes.
Son mis amigos, son mi familia. Sí, cierto.
Yeah, I saw a video of Dr. Juana Londoño operating, and I was like, wow, incredible. She's so good.
Yes. Son muy buenas, son excelentes doctoras.
She did his cataract surgery. Ella te operó.
Tell me, what was that like to be the patient in a cataract surgery? Tell me about this.
¿Cómo ser paciente de cirugía de catarata?
Yo soy muy buen paciente.
You're a good patient.
Yes, entiendo perfectamente y me paso de médico a paciente con anestesia local, me operaron como cualquier paciente de rutina, nada especial.
So just he was a good patient. He just had the anesthesia. He just acted like a regular patient, nothing special.
Yes.
Exactly.
That's.
Es decir,
Let me ask. Did you look at the light? Right.
Que si viste derecho al microscopio.
You know how we tell patients, we say, señora, por favor, mira la luz, por favor. Mantenga los dos ojos abiertos, por favor, mira la luz.
La filosofía es que todos los pacientes hay que mirarlos como si fuera uno.
Every patient is the same surgery as if it was you.
Así es. Entonces, si siempre operamos igual, como si fuera un familiar, no hay ningún problema cuando tenemos un recomendado.
So if you're giving the surgery as if it's your own family, everything's going to go great. You're not going to have any problems. So which lens did you choose? ¿Qué tipo de LEO tiene?
Tenemos un trifocal, panoptic.
Oh, fantastic. Panoptics trifocal. Y dígame, ¿cómo está la vista? Tell me, how's the vision?
No, la vista perfecta. De noche tengo un conductor asignado.
I'm the night driver in the highway.
That's good. So we say in English, you're the chauffeur.
Yeah.
No, mentira, no es cierto. No, bien. Tengo molestia con la luz, pero son tolerables.
He sees something, something with the lights at night, but it's very tolerable.
And in meetings, when you're doing presentations,
Yes.
I know that it's the glare from the lights. If you do a presentation in a meeting, I think it's very tough to handle with the trifocals. Yeah.
But
Yeah.
that's fantastic. So you were a good patient.
Yeah.
Yes, yes, good patient.
See, the problem with me is that tengo menos dos de miopía. I'm -2 myopia. And I love it because I just take off the glasses and I have such fantastic vision here that I don't know what I would ever do.
Carga. Sí, sí, sí.
Yeah, probably you have a few years there to decide.
Yeah, I got many years.
Yo cuando tengo un paciente no tengo mucho problema en explicarle. Yo le digo, le voy a colocar el lente que yo tengo puesto.
Yeah, that when in clinic it's super easy now to talk to patients because it's like, yeah, that's the same surgery I had, the same lens I have. I totally get you. You'll see more or less like I do. And if they have these photopsias or halos, he will say like, yeah, I get it. I get those too, but it's okay.
Y cuando el paciente me pregunta, ¿y quién lo operó? Yo le digo, la segunda mejor cirujana de la clínica.
So say translate for me.
So when patients ask who did the surgery for you, so he answers the second best cataract surgeon of the clinic.
That's too funny. That's fantastic.
Yes. Ay, caramba.
Yeah, I think surgery has changed so much. I just because you always send me videos that are the Ingenuity 3D high definition videos. So I'm thinking when you talk today, when you first started your practice, there's no microscope even. And now you're doing 3D high definition heads up display. I mean, what incredible changes.
Sí, que cuando empezaste no había microscopio.
Operamos con lupa.
Exacto.
With loops.
Y ahora tienes 3D Aura,
Así es.
Ingenuity.
Ingenuity.
Me he adaptado rápido a la tecnología. Me gusta la tecnología. Me gusta tener lo mejor para operar.
He loves technology, always gets what's best for surgery. So that's an important part too, then. Your clinic always gets the latest technology.
Sí, que la clínica siempre adapta la tecnología más rápido lo posible.
Súper. Tenemos, hace 8 años uso del Ingenuity. El Hora hace 5 años.
Yeah, so I think it helps, one, that you are very easygoing and tend to be an early adopter. I remember when we got the Ingenuity first, nobody liked it. You were the only one that used that. The Aura intraoperative aberrometry, you were the first one to use it as a daily practice. So it helps that
Los residentes y fellows se entrenan con Ingenuity.
and I think the 3D display is really nice for training actually. It helps.
Right, because all the young doctors, residents, and fellows can be in the OR and watch 3D live.
Con simulación.
And nowadays that they have 3D simulators, and they can start doing surgery pretty early in their training, and to see what the surgeon is doing, like that when we have a young resident doing the surgery, sometimes with the scope you don't actually see what they are seeing as a surgeon. So
Todos los micrófonos tienen cámara para grabar
Sí.
y tienen que ver la cirugía.
see, yeah, that every OR it's fully equipped with video equipment, the 3D, so training is very easy in the clinic. Yes.
I think that's a very important part, is that you make the investment to always buy the best and the newest technology.
Sí, que es importante invertir en la última tecnología.
Total, sí. Y hay que invertir, ¿no? Usualmente casi lo que renta la clínica lo reinvertimos, ¿no?
Yeah, that's one of the answers for how the clinic has grown. And I know that it's very different in the States, but in the States you have multiple partners in practices, but he has invested everything that the clinic produces into the clinic. So I remember that we used to move out a lot. Like we didn't buy a house, we rented our place all clients. I didn't really know why we had to move every 2 or 3 years, but it was because everything was invested in the clinic. So we didn't really buy houses or the places where we live because we put everything into the clinic. Que no comprabas casa.
Yes. Vivía arrendado.
Yeah, he rented for a few years, for a lot.
Well, that shows the passion. This is what you love. This is what you want to do. You keep growing it.
Una casa es un activo improductivo.
Yeah, so a house is an productive asset, but a LASIK or a phaco machine can be really productive.
Plus, I think this is like your dad's toys. Some people collect cars. Your dad collects like lasers.
Así es. Yes.
Tu hobby, sí.
Yes. No tengo yate, pero tengo clínica.
He has no yachts, but he has a clinic. La clínica es más importante. The clinic is more important than having it. I totally agree with you. 100%, I agree 100%.
Así es.
So what is next? What's coming in the future for your clinic? You had a lot of changes, you've had a lot of growth, but what's coming in the future? ¿Qué es el futuro de su clínica?
¿Cuál es el futuro de la clínica?
Estamos planeando, como tenemos muchas sedes aquí, estamos planeando un gran edificio donde tengamos todo.
So 25 years ago, he dreamed of building a huge eye clinic in a piece of land that he bought outside the city, but it was too big. So nowadays we have multiple offices around town, but the plan is to build this huge eye hospital campus in this place in the next 5 to 7 years. So that's the plan. And
wow, that would be incredible.
To make a very nice, we're working with this architect called Giancarlo Massanti, which is a very famous architect and trying to build a very beautiful thing for the city.
So how big will that be? Maybe like 10,000 square meters.
¿Qué tan grande va a ser?
Estamos haciendo un ecosistema
Ecosystem
de servicios.
of services.
Hotel, centro comercial, centro médico, centro de cirugía ambulatoria en un área de 20,000 metros.
So it's going to be more or less 20,000 square meters, but it's going to be like a campus with hotel, the eye hospital, an ambulatory surgery center for other fields, not only ophthalmology, and a small event center for meetings. Yeah.
That's fantastic. You could do a lot with medical tourism.
Yes.
Yeah, there is a lot of people around the region and the Caribbean that travel here. And
tenemos un área de influencia de 12 millones.
Yeah, so here around this area, we have more or less 12 million people that more or less are close by driving or direct flight. And so we get a lot of patients from abroad and the Caribbean. Yeah.
Yeah, I hope my Beverly Hills patients don't find out, because they could have an equivalent surgery, a beautiful A+ surgery for much less fee if they go to Barranquilla.
Espero que los pacientes de Beverly Hills no se enteren porque pueden tener la misma cirugía por menos.
I mean, A+ surgery. It's beautiful surgery that's done there. It's really incredible.
Yeah, I hope they don't get to this point in the podcast because you're gonna have to adjust those fees.
No, we'll leave it in there. It's okay. Well, this is I had a fantastic time talking to you. I hope to come. I'm definitely coming in 2026. I'm coming in 2026 for FECO Caribe. I hope all my Cataract Coach fans also come and join me. Even if you don't speak Spanish, don't worry. You can come. They have the translators and the headphones. You can understand it in English. It's okay.
Okay. Yeah, it will be a pleasure to have you here at your home. Que van el 2026 a Caribe.
Por supuesto. Sí. ¿Recibiste el pre-chopper que te envié con Kathleen?
Oh, for sure. So he has a special pre-chopper he has, and he gave it to Kathleen to give to me.
Okay.
Oh, fantastic. Yeah, she's going to give it to me in the Academy meeting coming up. So we'll take care of all that. Thank you. Well, Professor, gracias por todo y por ser un gran profesor para mí. y tantos otros médicos. Gracias, gracias, gracias.
Gracias, Uday, somos fan tuyo, vemos muchos tus videos empecé a ver tus videos cuando tenías 2,000 seguidores, ahora tienes 63,000. Increíble.
Wow.
¿Ah? El canal de YouTube de oftalmología mejor del mundo.
Fantastic. Thank you so much. Thank you.
Thank
And Luis
you.
Jr., thank you. I'm looking forward. I need to get a video from you now.
Okay.
You talked about a lot of good cases. We need to feature you on Cataract Coach. Please send me a good video.
Next week I'll send you a few. And
Okay.
you,
Anything, just about 5 minutes, anything interesting. I'll do the voiceover.
thank you. And I hope your son goes into ophthalmology. He has to be very proud of all the work that you have done.
I can only hope. But like I told him, I didn't follow my father, so you don't have to follow your father. Just follow your happiness, whatever your passion is. Like your dad said, follow your passion. If it's your passion, you're gonna do great.
Exactly.
So, my dad did ear, nose, throat, A-N-A-T. If I did ENT, I wouldn't have this passion. So I had to follow my own heart. But I hope a man can hope.
Yeah. Congratulations. Thank you. We're big fans.
Thank you, guys. And I want to remind our Cataract Coach fans, listeners, and viewers, remember, new podcast every week, everywhere you find podcast services, Apple, Amazon, Google, Spotify, you name it, we got it. Plus, of course, we have a new Cataract Coach video every single day, 2,300 something and counting. And we're never missing a day. So until next week, I'll check you later.